Before using your Trophon2 device, be sure to visit nanosonicsacademy.com to watch our online training videos and complete the multiple choice quiz. Upon successful completion of the quiz, you'll be able to print out a certificate to be kept on file. This is an FDA requirement. To prepare the probe for a cycle, the probe must first be cleaned and then dried. You'll want to wear a fresh pair of gloves. Be sure to follow the probe manufacturer's instructions for compatible cleaners and drying wipes. When cleaning the probe, be sure it's free of all visible debris, bioburden, gel, or any other residue, as this may interfere with the high-level disinfection process. Once the probe is cleaned, dry it with a single-use low lint or lint-free dry wipe. And don't forget to also disinfect your cord and connector. First, scan the medical instrument tag into the Accutrace RFID reader until you hear a beep. You'll then be instructed to load probe and chemical indicator, so you can go ahead and open your door. Once the door is open and you begin loading the probe into the chamber, use caution as the chamber may be hot or warm to the touch. Now, when loading the probe, you always want to use a two-handed technique so as not to damage your cord. You want one hand on the probe handle and one on the cord itself when loading the probe. So you can start low in your chamber, push into the cable clamp, and as you're doing that, pull up on the cord gently, and it should guide into place. There is a white cable seal where your strain relief should sit. Make sure the probe is not touching any of the sides of your chamber and that the tip of an endocavitary probe stays above the embossed line at the bottom of the chamber. When inserting an external probe into the chamber, you want to use a two-hand technique, one hand on the probe, the other on the cord itself. You can push the cord into your cable clamp starting low down in the chamber and gently glide upwards. Your strain relief should be resting within the white seals. The probe should be flush with the chamber without touching the chamber walls. Probe should always stay above the embossed line at the bottom of your chamber. Once your probe is appropriately loaded into your chamber, you will take a new chemical indicator from its box. Place chemical indicator red side up in the slot in your door. You can then go ahead and gently close your door. And then we can follow our on-screen prompts. So our screen is asking, is the probe clean and dry? We can go ahead and pick yes. And then it's asking us to scan our operator card to confirm. You'll notice that the door closes on its own before the cycle begins. Push the button right in the center of your screen to start your 7-minute disinfection cycle. Once your cycle is complete, your screen is going to take you through some prompts. Right now, it is telling us to remove probe and chemical indicator, wear gloves, and wipe probe. So at this time, you'll want to make sure you perform hand hygiene before donning a fresh pair of gloves. Using two hands and a single-use low lint or lint-free dry wipe, we will remove our probe by lifting in an upward motion. Now that the probe is removed, using the dry wipe, ensure that there is no visible residue or moisture on the probe by wiping the probe and handle. And then, taking a clean probe cover, carefully place the probe in the bag for storage or as required by your facility's policy. Now remove the chemical indicator and validate by comparing it to the minimum effective concentration, or MEC, on the box it was removed from. Note that the color is lighter or more yellow than the MEC, indicating a successful disinfection cycle. If your indicator or your touch screen indicate a cycle fail, you will rerun a cycle using a new chemical indicator. When the door is closed, the display will be asking you to select pass or fail by choosing the result on the screen. So we are going to say that it passed. and you will be prompted to scan your operator card to confirm. The overall cycle result will be displayed on the screen. At this point, the labels will automatically print out. You can now go ahead and press OK, and the Trophon will recalibrate for the next cycle. Now place the first printed label on the outside of the probe cover to identify that this probe has been properly high-level disinfected. Finally, place the second printed label in your designated high-level disinfection log, along with patient identifiers per your facility's policies and procedures. You have now completed a successful high-level disinfection cycle of an ultrasound probe utilizing the Trophon2 device. The consumables required to run a cycle on the Trophon2 device include Sonex disinfectant cartridges, chemical indicators, and printer paper roll, if a printer was purchased. The Sonex disinfectant is a highly concentrated hydrogen peroxide solution. Each cartridge will yield approximately 20 to 40 cycles, depending on the frequency of use. Once a cartridge is loaded into the unit, it will expire in 30 days. Users will be prompted on the LCD screen when the cartridge is empty or it's expired. Please note that the device should not be tilted more than 15 degrees in any direction once the disinfectant is loaded. Sonex cartridges must be stored in an upright position to prevent leaking. If the cartridge is empty, you'll be alerted on the display screen. Put on a fresh pair of gloves and follow the screen prompts to scan in and load a new cartridge. On the other hand, if the cartridge expires, users will be required to move the expired disinfectant from the inside of the device before inserting another cartridge. This can be achieved by running a purge cycle, which the display will instruct the user to do. When the purge cycle is initiated, the device will start removing the disinfectant by breaking it down to its byproducts, which are oxygen and water. The water will collect in the waste drawer located in the right side of the device. When purging is complete, the user will be instructed on the screen to remove and empty the waste container. The water from the waste drawer is perfectly safe to dispose of in the sink. Just rinse the container, dry it, and replace it. Then follow the prompts on the screen to replace the cartridge. Chemical indicators are used to validate the disinfection cycle. A new indicator is placed at the bottom of the chamber door with each cycle. Chemical indicators must be stored in a dry and clean environment out of direct heat and UV light. Users are responsible to ensure that they are using chemical indicators that are not expired. The expiration date can be found on the back of the box in the lower left-hand corner. Some additional optional supplies include Trophon clean covers for probe storage, Trophon companion cleaning and drying wipes, which are compatible with most ultrasound equipment and can be used as a low-level disinfecting wipe. Please note that most ultrasound manufacturers state in their IFUs that paper towels should not be used to dry the probe since they may be too abrasive for the probe, especially the lens. And there are also logbooks to document your high-level disinfection cycles. If a printer was purchased, you will need to insert the paper roll. The printer is a thermal printer and does not require an ink cartridge. Pull the green tabs forward on the sides of your printer to open. Next, open the green arms. And you can place your printer roll with the paper feeding over the roll. Next, tuck the front under the two green tabs on either side of the printer. and feed through. When the paper is inserted properly, it should look like this.